was 23 at the time.
I was 30 years old.
I found out a week before I turned 50. How's that for a birthday present?
I was taking a bath.
It's a little larger than the size of a pea.
Tiny itty-bitty pinhead speck of blood in my bra.
We didn't call you? And I said, no.
They didn't just say come in, and they said, and be sure to bring your husband.
My knees buckled and I sat down. Terrified was more like it.
I thought this is the most insane thing I've ever heard of.
It's a gut reaction of despair.
What does that mean? What do I do now?
Are you sure you have the right person?
Hopelessness.
My children are never gonna remember their mom.
This can't be happening to me. Anxiety.
I'm the one that did all the right things. I always got my mammogram. I did all the medical things like you're supposed to at the certain times. And I'm the one that got cancer.
When I was 18 years old, I first found a lump in my breast.
35 to me seems very young.
When you're in your 30s, you're kind of wrapped up in other things, and life throws you a curveball.
How come already I'm getting it again for the second time and at 29?
I have a clinic for indigent patients, federally funded.
I went to the Air Force Academy and got my degree, and I was accepted to pilot training.
I have 3 boys.
In my department alone at the hospital where I was working at, 5 of us had breast cancer.
I was Mrs. Georgia America 2007, 2008.
Right now I practice yoga.
Took vitamins, exercised, ate healthy. People that I work with go, well, she eats the weirdest food.
I've always been one of those driven women, and sometimes you can make the mistake of thinking that it's because of you.
We have Alzheimer's, we have heart disease, so I should have had a heart attack and not know about it.
I do not have family history.
No, there was no family history.
None.
It was just a death sentence. Women were just mutilated. They were left, they were going to die. They could never be themselves again, and they were just, scarred for life.
About 20 years ago, they removed the right breast and sent me home. The doctors were so confident that I wasn't going to live.
My grandmother had a radical mastectomy, which back then, I was little, maybe 10. They took the whole chest wall, and there was this giant, it was really quite not good.
The only person in my family on my mother's side and father's side who didn't have breast cancer was my mother. And so I saw them, scarred and really almost mutilated. My mom used to talk about how she would get up in the morning and put her body back together. She'd put her wig on, her teeth in, and she'd put something inside her bra. She did have a radical mastectomy, which was horrible. But she also was a very brave woman, and I think she did it for me and for my sister and for everybody out there, so that they could learn better how to attack this disease and how to possibly cure it.
I remember as a medical student, never forgot it, rotating through surgery, and it was another woman and me, and we went into a room, and it was a radical mastectomy. They left skin and bones, and it was a young woman, and the guy opens up the robe, which we thought was horrid as women, and says, "Isn't this beautiful?" And the lady looked at the two of us, 2 medical students, green as can be, and she looked at us and said, "Isn't it horrible?"
My mother passed away when I was 12 from breast cancer. So she was premenopausal, she was 39. I'm youngest of 4, so what I remember is the tragic stuff, the ending, the chemo, the radiation, all that. It's terrible because that's the memories that replace everything else.
things are just so much better now. And even now when I come in for a visit or something, they have what now? I mean, the technology and the advancement is just progressing every day. So, I mean, I just think the future looks very bright, which it didn't back from my mom.
It was something that I was anticipating having, but not at the age that I had it. I was 46 when I was diagnosed.
I went for my routine mammogram. My doctor sent me, because I had turned 35, just for a baseline.
I'm supposed to get this mammogram. I'm 30, that's what they told me to do. But then, you know, when it came back that there was actually something on the mammogram.
It came over the facts that there were changes and I had to go back for another mammogram.
My internist said he felt a lump. And he said, but it's probably nothing and you're always checked. And when was your last MRI?
They found this spot and the radiologist told me, she said, you are very lucky because this particular part of your skin is not on any other mammogram that we have.
These are little calcifications. And she said, are you sure you've never had any trauma to your chest? I said, I'm positive. She said, this doesn't. She said, I need to do a biopsy. I said, this doesn't look good.
They had a very hard time finding it when they were doing the biopsy. It wasn't a mass at all. It was teeny. To this day, I don't know how they saw it. It was minute.
The man looked at me and he said, this looks horrible and this cannot be anything but cancer.
Wow, breast cancer, and at 23 years of age. So, and then that evening I gave birth to my son, Owen. So it was like, okay, diagnosed with breast cancer, and then guess what, we're having this baby tonight. So I think it was probably the emotion of the anxiety.
Took my breath away, I started shaking.
I brought my friend because I wasn't hearing anything anyone was saying to me.
In the initial couple of days after you're diagnosed, you think, and I guess everybody goes through that, why me?
I said to the nurse, no, it can't be cancer, so just please take it off. And she said, well, I'm really sorry, but I can't.
You think of cancer as a death sentence.
All I could think of was my children. I'm not going to see my grandbabies.
Oh my God, this thing is going to continue growing on me. I need it out immediately.
It was devastating at first, and then it just was like, okay, now I gotta do something about it.
It was a very hard decision to allow them to remove a body part. I had a 0.1 speck of calcium in a mammogram, and the films from the mammogram. I did not, when I went into the first surgeon's office, expect to hear the M word.
I went to the little, I guess, education thing they have at the breast center, and there was 8 women in there. And of the 8 women there, 4 of them were back for a second time. You know, one had had a mastectomy, then she had to get the other side done 2 years later. One had had a lumpectomy, but they didn't get it all and had to go back. And it was just, I listened to that and I thought, wait a minute, like I don't want to live with the fear of it happening in the other side.
Both myself and my husband are very logical thinkers, and I mean, to us it was just a no-brainer. You just have a bilateral mastectomy and then you're done.
It was a no-brainer for me because I'm like, you know, I've gone through it once and it came back.
I've dealt with this concern about my breast every 6 months for 5 years. Get rid of them. I don't need them anymore. I'm not breastfeeding anymore. Take them off.
I said, how many comebacks do you get? And she said I was double risk off the top already. So when she told me that, I just thought, okay, that is what I needed to hear.
My prayer was, whatever happens, don't put me in a position where I don't have to make a choice. Make everyone make the choice for me. If I have to have a mastectomy, then tell me I have to, you know, be in a position where I have no choice. If I have to do chemo, then don't say I'm on borderline. I just didn't, and my prayer actually came true because everything, I had no choice.
She recommended that I have a mastectomy. It was on the right side. And I said, I'd already made up my mind, you know, that I said, I'm just meeting you, and you're probably the best doctor in the whole wide world, but I never want to see you again after surgery. So I chose to have a double mastectomy done.
If I have one chance, I will get rid of my breasts immediately, you know? If I could have cut them off myself, I would have done it.
I did the testing to see if I had the BRCA mutation, which I don't. If I did, I would have had, you know, a mastectomy on both sides.
It took me 3 to 4 months to figure out to go ahead and do the surgery. No family history. Why cut off the other side?
My doctor at that time thought it was kind of overkill for me, that I should just concentrate on the diseased breast and not worry about the other one. But in retrospect, I wish I had done it because it's something that I always have to worry about.
I had these lumps. They weren't full of cysts. They weren't full of fluid or anything like that. They were just masses. So I constantly had needle biopsies, lumpectomies, mammograms, ultrasounds, and I just said, we were starting to call them Frankenboobies. So I just said, you know, there's got to be some way to get rid of them.
We'd like you to come back. We'd like to do an ultrasound. We see a little something. You know, one year I had I had to have a lumpectomy, and every year it was something. So it seemed like I spent my whole life getting ready to have a mammogram, or waiting to have the follow-up from the mammogram, or waiting for somebody to tell me what they'd found.
There's nothing wrong with you, you know? So in your mind, I think, maybe I'll be fine. You know, maybe I'll be fine. I don't need to do this, go through this. On the bright side, I do feel more confident now that I've reduced my chances the best I can. You know, I'm back now to where anybody, regular person would be.
When you make that decision to be a survivor, it doesn't matter if you're like, no, I think I just want a lumpectomy, or I think I just want to do this one side, or I think I want to do this. When you make the decision to be a survivor, you do what it takes to get to the other side.
Do whatever you think is necessary to just live, period.
People think it's way more traumatic than it was. I've had way worse things happen to me.
Knowing that you're going to beat it helped in every way possible to get through what you have to go through.
Mentally, you have to get to a certain place every day when you get out of bed. Things that are external don't define you. You define everything around you.
At the beginning, you don't think you would be able to survive all this or go through all this. But because it comes in stages, somehow you get over it. You just go through it one step at a time.
I can't imagine that anyone that was diagnosed with breast cancer or any type of cancer, that their families are not also emotionally affected. It just has a rippling effect.
I had, I think, 10 or 12 friends. Every morning they would call me, and they would either bring me magazines, send somebody over to do a pedicure. Every day was a different day, so I wouldn't get bored.
My daughter, was getting ready to go off to college, and she was going up to Boston. It made her think that she needed to stay home and be with me. And I was like, no, you have to do your thing. I'm sorry, I'm gonna cry. And she did, and she graduated, and she's a great girl.
My 8-year-old wanted to know every scientific term, every answer to every question, why radiation was this way. I was just very caught up in the process and what was going on and what was going to happen after. My 13-year-old was very funny in the sense of, Mom, please make sure you put your wig on. She wanted me to look okay.
My husband really was remarkable. After surgery, when I went in my room and he was there and he saw me and he said, Meryl, you have a breast.
My husband rocked during the process. He was absolutely amazing.
My husband, when I was going through breast cancer, couldn't fix me, but he could fix a rock wall. So he built me a rock wall that we have around our Japanese maples.
It made me realize that my husband loves me and my children. I mean, I'm almost thankful I went through this because I saw the side to my family that I wouldn't have seen.
The people who supported me the most were my HIV patients. Why? Because they knew what it was like to be facing an abyss, looking at what could possibly be death at an age that you never expected.
Whenever I got weepy about what I was experiencing, it wasn't about the cancer and it wasn't about health. It was about the love and support that I felt throughout this entire experience.
If you don't have support, find support. Ask the doctors, find somewhere to go to get support.
Your breasts are part of who you are from a very early age.
I want it to look the same. You want normalcy once you've gotten a cancer diagnosis.
The last thing you want to do is look at yourself in the mirror and think, look at me. So, I mean, we chose to do the bilateral mastectomy with the implants.
Funny story is my kids used to say, Grandma, you left your boobies on the dresser. When I was told I could have the reconstruction done, at the same time, it was like, oh my God, my kids don't have to go through that again.
I couldn't figure out how I would face life with no breast. I had made it with one, so I did it.
Even though I had all that pain, it was worth it. It was so worth it.
She had all these photographs of breast. And I'm looking at that going, well, you know what? Maybe it's not such a big deal. Came out with looking like a Barbie boobie.
Once I'm rid of cancer, then I have this great looking body. And then my mind and my spirit followed. That was huge to me.
I chose to have the reconstruction because I wanted people on the outside to see that nothing's different. Personally, physically, I think they look nicer.
When I got out of the bed the morning after my surgery and I walked into that bathroom and I took that hospital gown off and I had breast. And I went, this is a good thing.
I got voted best rack in the office. I like my boobs.
I told my psych one time, I said, I am obsessed with nipples these days, and the damn things are everywhere. So I had that surgery, and that was great because I was very proud of them. And I called my sister. I said, Susie, I look normal. I look real again. I said, if I didn't have on a bra and I bent over and somebody looked down my shirt, they would never know it looks that real. So then I was delighted. And she later told me she hung up and boo-hooed because she said it was the first time she had heard me sound happy about it.
One of the things that was helpful for me, because you go to so many different doctors and radiologists and that type of thing, is to keep a book with all the different tests that you've had, whether it's a blood test or a bone density. And I've got, like a little calendar.
You have to be your own advocate.
Find a doctor you can communicate with. Find one that's going to listen to you, who cares about who you are and what's going to happen to you and how you feel about your cancer and how you feel about your reconstruction.
It's your disease, you handle it how you want to handle it. Some people want to talk about it, other people don't. So that's your choice.
The clinical side of it is like, well, it's not about the quantity of life, it's about the quality of life. And so I'm like, what are you telling me? I'm going to die in 5 years? That's not what they're saying. The saying is, if you have fun, it's about not letting it consume you, not sitting and Googling, breast cancer. It's about, just getting out there and living life.
I just chose to get up every day, to put on my makeup, became one with my hairpiece, and just decided to go forward and put my best foot forward. And that helped me. That allowed me to get through my days and feel normal.
But my best thing I would say to anybody facing this is, it's going to get better. And the light at the end of the tunnel really is not a train. It really is a light, and you do get through it. But it's a heck of a journey.
A young lady came in the day after my surgery, and she stood by my bed, and she told me her name, and she said she was a survivor.
I volunteer at Northside Hospital. It's paying it forward. Somebody visited me and it was significant, and I thought they looked amazing, and I thought, oh, there's a lot of hope at the end of this road.
I remember one time walking in, and I think she was very young, maybe 24, and she was crying, and her husband was crying, and I looked at him and said, hey, I'm getting nipples next week. This is like not so bad.
Everybody has seen my breasts that's in my community because so many people have had breast cancer, and they're scared, and they're like, oh my God, I'm gonna be disfigured forever, and so, I pull out my tit.
Somebody had walked the 60-mile walk for me when I was diagnosed. And she raised a lot of money for the cause, and I told her when I felt well I would do the walk. My team raised $350,000 for research.
I'm so excited to be able to inspire other people and to show them, hey, you don't die just because you have breast cancer. You continue, you go forward, you learn from it. You are above this, and you can live your life and be happy and be whole again.
You just see how many wonderful people are out there, and my mission is to spread the word to, get a mammogram.
Help save my mom's life. Hopefully she'll now never have to go through what I went through, so I've saved her. My husband's mother was diagnosed the same time I was the first time, and the only reason she checked herself was because I was diagnosed, so I've definitely saved 2 people's lives.
Early detection. It is so key. It saved my life.
There is a before and there is an after. And the after is actually much better than the before.
There's life after breast cancer.
You appreciate everything more. You have a different outlook on everything.
I don't really sweat the small stuff anymore.
I live in the moment. I enjoy my day.
I beat this and I'm stronger for it.
I felt very kind of powerful inside.
I'm doing more what I want to do.
People take pictures of me because they can't believe it, jumping into the river or parasailing in Mexico, and I've had a lot of fun.
I quit my job and I just said I'm gonna relax. Everyone tells me how great I look. They tell me I'm happier.
My golf game is not good, but I do, I do everything I want to.
This year, when I got in the lake and I jumped up on one ski and I thought, I'm back. Nothing's different. I just feel better.
There's no physical limitations whatsoever. I mean, I'm jumping around. I have a 6-year-old boy. We go swimming. We go on the amusement rides.
Her name is Charlotte, and she was born on Christmas Day, 2007. Going through the breast cancer, I kind of forgot everything when I was pregnant with her.
I know this is cliche, but it is the best thing that ever happened to me.
When mortality has hung in your face that close, you really do rethink life completely.
It is an amazing, amazing, amazing journey. I wouldn't wish it on anybody, but I am not, and I wish it hadn't happened, but I'm not unhappy that it did. I've learned to live with it and accept it.
You are a survivor, and you're not scarred for life because you had breast cancer.
So my goal is to be 80 and to be perky. So they told me I would, and I think it's going to happen. I know it's going to happen.
I'm thankful to be alive, and I think a lot of people don't get to experience how precious life is. So now it's like, wow, we're here and we love each other, and wow, you only get one chance at this, and you make it right. So it's good. It's really, really good. Would I change it? Would I like to not have cancer? Absolutely. But if I had it, would I go back? No, because I'm fine and I'm living.